My presentation is on patient rights. Patient rights are legally required within the American healthcare system. The right to be treated with respect is that all patients should be treated respectfully related to their care. Patients have the right to obtain their own medical records. If the patient decides they want to go to another hospital, they have the right to collect their records for a second opinion. The HIPAA Act of 1996 provides patients in the United States a right to obtain their medical records and limits to who can collect their records. The patient has the right to make their own treatment choice. If the patient is in their right mind and considered to be stable mentally, it is their right to know about them. It is their right to choose how they are going to go forward in their medical care. Patients have the right to informed consent. The doctor supplies the patient with all the details of the upcoming procedure, and the patient can decide if they want to proceed. With that being said, the patient can also refuse treatment. The patient has the right to refuse any medication, any tests, surgeries, and care they do not want. They have the right to make a choice about end-of-life care. The patient might not want CPR, would be an example, or put on a ventilator, and they have the right to say so. Here I have listed some different medical ethics. There's 4 medical ethics to consider that I think are important, which would be autonomy, justice, beneficence, and non-maleficence. The first one is autonomy, and it requires that the patient have autonomy of thought, intention, and action. This is practiced when the patient is making decisions regarding the health care, and the decision-making process must be free of coercion and coaxing for the patient to make a fully informed decision. The patient must understand all the risks and benefits as it relates to their medical care. Justice is the idea that the burden and benefits of new treatments must be distributed equally among all groups in society. This requires that all procedures uphold the spirit of existing laws and are fair to all players involved. There should be fair distribution of scarce resources, competing needs, rights and obligations, and potential conflicts with established legislation. Beneficence requires that the procedure be provided with the intent of doing good for the patient involved. It demands that healthcare providers develop and maintain skills and knowledge continually to consider individual circumstances of all patients and their benefit. And the non-maleficence requires that a procedure does not harm the patient involved in or others in society. So my ethical dilemma as it relates to client rights is autonomy. I encountered this dilemma while working as an LPN. My patient was a 63-year-old female with stage 4 breast cancer. She noticed a lump come out on her breast and chose to hide it from her family. The mass grew, and she knew she had to tell them. She had three daughters, which were all accompanied her to the doctor to find out that she had this stage 4 cancer. The family was so upset, and they wasn't sure what was to come. This dilemma started when I asked the patient if she wanted CPR. The patient quickly said no. She said she wanted to be a DNR. Her daughters were very upset by this decision. They had just found out their mother had cancer, and now she don't want life-saving measures if her heart were to stop. The patient was alert and oriented to person, place, time, and situation. She had the right to autonomy and make her own choice. As the nurse, it was my job to honor the patient's wishes regardless of how her daughters felt. The patient was very clear on what she wanted to be done, Ethically, autonomy aims to protect individual choice, rights, freedoms against the control of organizations, estates of other people, even family. As the conversation progressed, the patient also refused to have any life-sustaining cancer treatment. She said she wasn't going to have all that go in her body. She stated she wanted to enjoy her life feeling well. Life-sustaining treatment is any treatment that serves to prolong life without reversing the underlying medical condition. This may include mechanical ventilation, renal dialysis, chemotherapy, antibiotics, and artificial nutrition and hydration. This was another emotional problem for the daughters. They couldn't believe their mom kept the information of her health from them to now find out she doesn't want any treatment or no CPR. As my shift continued, I began reflecting on the position I was put in. I felt bad for the daughters, but as the nurse, the patient's wishes are my first concern and priority. There is no ethical distinction between withdrawing and withholding life-sustaining treatment. A competent adult patient may formulate and provide a valid consent to the withholding or to the renders that individual and competent to make such a decision. The patient is simply practicing her right to choose. It is important as the nurse to support the patient in their medical wishes and ensure that the medical team is remembering those wishes. At times, nurses will need to continue to advocate for a patient despite the wishes being verbalized because the medical team might not agree in those wishes. Nurse code of ethics at hand in my dilemma is the first one will be the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. The nurse's primary commitment is to the patient, whether an individual, family, group, community, or population. The nurse promotes and advocates for and protects the rights, health, and safety of the patient. And the nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and acts consistent with the obligation to provide optimal patient care. As the nurse in this situation, I have compassion for the patient. My primary commitment is to the patient. I will advocate, protect the rights, health, and safety of the patient. When providing end-of-life care, nurses serve as the patient's advocate and manage pain and suffering. Nurses have the moral obligation to facilitate a patient's right to self-determination. Nurses who deliver palliative care must understand that their actions are targeted at relieving pain and suffering and not hastening death. According to provision 1.4 of Code of Ethics for Nurses, the nurse should provide interventions to relieve pain and other symptoms in the dying patient, consistent with palliative care practice standards. End-of-life issues shift the focus from curative care to palliative and end-of-life care. Needs of patients and families require holistic and interdisciplinary approaches. End-of-life issues that often involve ethical dilemmas include pain control, do not resuscitate orders, life support measures, and administration of food and fluids. In summary, nurses are faced with ethical dilemmas every day, where no right answer is clear. The dilemma is very common during end-of-life care. During this time, patients and family may experience elevated emotions, grief, and loss. During end-of-life care, ethical dilemmas can happen, such as patient autonomy being compromised, ineffective symptom management, and shared decision-making. As the nurse, we can navigate ethical dilemmas by offering the best possible care while allowing patients and family members opportunities to approach end of life with dignity. Something I think is very important is communication. As a nurse, I can have the conversation with my patients and their families as it relates to their diagnosis and management of care. The question about code status is asked at the beginning of the admission process. This is to make sure before their plan of care continues, the healthcare team knows their wishes. As the nurse, it is my priority to make sure that this happens. I will listen to my patients' concerns and desires, and I will always advocate for my patient to the healthcare team.